This is the video on sections of the midbrain. The midbrain is part of the brainstem and has a complicated internal structure. It consists of three parts: the tectum, the tegmentum, and the crus cerebri. The tectum consists of two paired structures which bulge outward from the posterior midbrain, the superior and inferior colliculi. The superior colliculus controls reflexive head movement to visual responses. The inferior colliculus controls reflexive head movement to hearing responses, such as you heard a loud noise and your head turns towards it. The tegmentum has several important structures. There are the right and left medial lemnisci, singular lemniscus. This is a large bundle of ascending fibers that carry sensory information from the body to the cortex. The fibers move upward to the medulla, synapse on the cuneate nucleus and the gracilis nucleus, cross over in the medulla, and travel as the medial lemnisci in the midbrain. The tegmentum also houses the nucleus for CN3, the oculomotor nerve, and CN5, the trigeminal nerve. The medial longitudinal fasciculus, which controls the direction the eye should move, integrates information from CN3, CN4, and CN6, so eye movement is coordinated among all the eye muscles. Another area of importance in the tegmentum is the periaqueductal gray matter. It surrounds the cerebral aqueduct, thus the name. This nucleus plays a role in pain modulation, helping to suppress painful stimuli. It is critical in motivated behavior and responses to threatening stimuli. The tegmentum is where the red nuclei lie. The red nuclei are so called because on sectioning the brain at the level of the midbrain, these look like two red spots. The red nucleus plays a role in movement and motor control. It has connections to the spinal cord, the cerebellum, and the motor cortex. It is part of the extrapyramidal motor system. The rubrospinal tract crosses over in the midbrain. The crus cerebri are two large structures protruding from the front of the midbrain. It contains several fiber tracts. The corticospinal tract originates from the motor strip in the cortex to the lower motor neurons in the spine. This pathway contains the signals for all motor movement of the trunk and limbs. This tract contains the axons of more than 1 million neurons. Behind the cerebrospinal tract is the substantia nigra. This nucleus is black due to the large amount of dopamine it contains. The substantia nigra modulates movement, making for smooth mobility. When the substantia nigra is diseased, the result is a tremor, difficulty initiating movement and stopping movement. This is known as Parkinsonism, and there is no cure. This ends the video on the sections of the midbrain.